Hi, this is George with the Crotchety Old Men podcast. Gary, Paul, and I are on vacation this week, so we are replaying one of your favorite podcasts. We hope you've been enjoying the information we have been sharing. We love your feedback, so drop us a line at the crotchetyoldmenpodcast@gmail.com. Enjoy this podcast.
Greetings and welcome again to another episode of the Crotchety Old Men podcast. Hello, I'm your host today, Gary Smith, and we got a full house today, ladies and gentlemen. Full house. No, I'm not talking poker. I'm talking about a full house in the studio. I got my main man, PC. What's happening, PC?
Hey, what's going on? How's everybody?
Hey, man, we doing great. We doing great. And then, of course, my partner in crime, I call him our engineer, y'all. George Crumley, top of the day to you.
Top of the day, Smitty. How you doing?
Man, I'm doing great. Today is the best day of my life.
There you go. There you go. That's the attitude to have. Attitude of gratitude.
Amen. All thanks, no complaints, my friends.
There you go. We can rhyme all day, right?
Can we? We the crotchety old men, so we started rapping before it was popular.
There you go. There you go.
Give me a beat. What we talking
go.
about today, gentlemen?
So, as we here again start off into this new year, it's interesting that we want to talk about men's health. I mean, that's so important. I mean, we've talked about this before. You can have, as much money as possible, but if you don't have your health, you don't really have anything. So I think it's really important that we talk about health. And one of the things that sometimes black men are subject to is prostate cancer. So we've got PC on here today, our holistic expert, and he's going to talk about prostate cancer, what to look for and those kind of things. So, hey, PC, start us off. So what is prostate cancer? Let's break it down. What is that?
Well, prostate cancer is cancer of the prostate. And cancer is an abnormal cell that usually takes over normal cells and the body's inability to fight this cancer off. Okay. So this cancer starts in the prostate, is specific to the prostate. However, once the cancer is in the prostate, if without treatment of the prostate or the treatment of the cancer of the prostate, it can metastasize into the bones, which is the personality of that prostate, as every cancer has a personality. So you want to catch this cancer. It's as it relates to all cancers, it's probably one of the slower moving, slower growing cancers that you have. So in other words, you have time once you start seeing symptoms, you have time to really look at what it is, whether you need a biopsy or not, if the symptoms are severe enough, and so on. So that's basically what prostate cancer is.
So, PC, tell us, what are some of the symptoms of prostate cancer?
Good question. And there are quite a few symptoms, and quite a few symptoms that we as brothers, or men in particular, overlook. The major one is BPH, which is no more than a swollen prostate gland. Okay. When you have swelling of the prostate swells the prostate gland to the point where it cuts off the urethras where your urine runs through. And now you have a narrow stream. You're not kicking the bubbles like you normally would on a normal day, it's starting to trickle. That's a good indication that you really need to check to make sure what kind of health your prostate is in at that point. Okay. Another serious symptom is blood in your urine. If you have red scarlet blood in your urine, then that's a good indication that you need to go get your prostate checked. Pain in the hips, back, or spine. Those are other areas that you can tell. Weakness or numbness in your legs and feet. Or you need to urinate more often. You know, Gary and I talked about getting up at 3:00 in the morning, urinating. But if you have to do that more than that, then you need to go to your urologist. And then the last but not least, at any point, is the inability to have maintain or sustain an erection. Those are the symptoms that drive us to the urology doctor.
So interesting enough, the first thing you said was enlargement of the prostate gland, but isn't that normal as we get older? Doesn't the gland get larger? So how do we know it's a difference between an enlarged prostate? Because there's a name for that. I'm sorry, I'm not a doctor, but there's a name for that, and I'm sure you're going to say what the name is. What's the difference between an enlarged prostate and prostate cancer?
The name of the large in prostate is BPH. And there is very little difference. And that's a good question, George, because you really need to, check to make sure and check thoroughly. So here's the thing. The, medical association feels that if you're a man 50 years or older, you need to check on your prostate yearly. I maintain, because my DNA is different from white people's DNA, I need to check on mine earlier. I would suggest 40 years of age for us, because foods, air, everything that we imbibe makes a difference for us 10 times greater than it does for the Caucasian side of the equation. Okay. So, the second thing is the American institutions have raised the idea that instead of 50, you go from 55. And then they tell you that if you're 70, you shouldn't get your prostate checked as much. I don't agree with that whatsoever. Because 70 now is becoming the new 40 and 50. So, if we're going to stay active, if we're going to stay healthy, we need to keep checking our prostate. Does that answer your question, George? It
does.
Okay.
And it brings on another question is, so I'm one of those guys that, I get a physical every year, and I've noticed that the change is they no longer automatically want to check your PSA, right? And then
Yes.
they don't want to do the digital rectum exam. So how do you, keep a healthy prostate, or how do you know if there's an issue if your doctors don't want to do those two basic exams?
Because we're years old that we are, they're going to have a tendency not to include the PSA in your panel. PSA is a prostate specific antigen. And what a prostate specific antigen does, it picks up the glycoprotein, all right, that is inserted in the blood if the cancer's there. Okay. And they have numbers, anywhere from 1 to, I've known people have gone from 1 to 11 in a matter of months or so. And so doctors, urology looks at the changes in the numbers. So let's say we go to our local doctor. He orders a blood panel. He doesn't include the PSA on there. I would request it. And this is why it's necessary. Gary has a great saying that I love, and I repeat as soon as I can get it out my mouth. And that is, everybody is responsible for their own recovery. So you have to parlay with your doctors. You need to talk to your doctors. You need to tell your doctors how you're feeling, and be honest, because, not omitting symptoms and things that you're feeling is not going to help you at all. So the specific antigen is in the blood. let's say, for instance, last year you were a 1, and let's say you went from a 1 to a 4. That's in a year's time. That's an extreme change. But let's go to the converse of that. Let's say you have a 1 last year. That's your baseline. And let's say, for instance, the next year is 1.1 or 1.2. That's not such a severe change at all and would not require a biopsy. Okay. But I would certainly get the PSA. Now I noticed that doctors have backed off during the digital rectal. And, I certainly don't like them. And I'm sure you all don't like them either.
Not at all.
for obvious reasons. But here's the thing. How practical is the digital rectal? Well, the doctor can feel nodules on the outside of the prostate, but what happens if that cancer is developing on the inside? And when those proteins are released into the blood, you can find that out with your PSA. And it's not invasive. That's the other thing. I want as much and as little invasiveness as possible on my body.
Absolutely. Absolutely. So you say, PC, that you should probably get black men in particular should start having their prostates checked in the earlier stages in life. How much does diet affect the prostate? I mean,
Diet's key.
Yes,
Diet is key.
Can you expound on that some?
Here's the thing. Diet is your foundation. It's like when you build a house. You know, you have a foundation, you have a basement, and you build from that up. Your diet is your foundation for all your body functions. And so, let's see, things that are good for the prostate would be, saw palmetto berries, which is an herb, cherry juice, which is an herb that fights inflammation. The prostate has a lot of, is able to, attract information because of how it's made. It's a spongy material. You have holes in it. Inflammation and disease can hide in these holes, and now you have infections. And it's walnut shaped. It looks like a walnut. And it's about the size of a walnut. So you figure if you eat walnuts, that's helpful towards your prostate. Olive oil is helpful towards your prostate. There are a lot of fruits and vegetables, primarily fruits and vegetables, and less meat, especially red meat. Okay, because red meat can be kind of detrimental to your prostate because of the uric acid that's in it.
So what happens if, unfortunately, you do get prostate cancer? How is that treated?
Well, before you get the cancer, or before the cancer is diagnosed, there's certain tests. We talked about the PSA test. We briefly talked about the digital rectal test. Then they have what they call a biopsy. And a biopsy is a needle that's inserted into your rectum. It perforates through into the prostate. Exactly, Gary. It's painful as hell. And, we really don't want to talk about, we want to talk about that less than we talk about the digital rectal. But it's that much more severe. Okay. So once they have the PSA is high, you've had the symptoms, then they go to the biopsy. Okay. Once they figure out that you have cancer, then they sit down with you and they figure out, first of all, how aggressive is the cancer from 1 to 9. There's a scale from 1 to 9. Cancer, the prostate is usually, not very aggressive. It's not the nature of that particular cancer. Okay. So you have, a month, 2 months, maybe even 3 months depending upon whether they've caught it in the first stage, second stage, third stage, or fourth stage. Fifth stage is end stage, which means you're dying or dead. So it depends upon what stage and how they're going to treat it. And here are two methods of treatment. You have, actually three methods of treatment. You have number one, you have radiation. You have, you can do chemotherapy, and then they have extraction. Okay, so it just depends upon what your flavor of the month is, what's comfortable to you, what you're able to, deal with after the fact. For instance, if you're going to do the radiation, that depends upon whether they're going to do a beam and mark you up, and you have to go to that beam every time they make that treatment, and that beam has to be as precise as it was when it was marked up. Question I have in my head is, am I going to be laying on the same position at the same thing every time? Not necessarily so. So what happens with the beam is you're killing good cells along with the bad cells. The other thing is, if you get the seeds where they put in your arm or whatever, they put out radiation every so often, and that's another form of radiation that they use. And a lot of men prefer doing that because we feel like if our prostate is gone, we can't have any sex, which is not true. Okay. All the prostate does is it's an accelerant for our ejaculation. And the reason we need the prostate to accelerate our ejaculation is if we want to get somebody pregnant. Okay. So we at our age aren't thinking about getting anybody pregnant. I mean, let's be real.
No,
So,
Lord.
And once the prostate is removed, and as long as they figure out that there's no metastasis of that prostate, that's another way of healing and getting rid of the prostate, just totally removing it. Now, a lot of brothers don't want to deal with the removal of the prostate is because the prostate is in a nest of nerves. And when you cut the prostate out, sometimes you hit those nerves that are crucial to your erection. And if that happens, you can't maintain an erection. However, they have what they call an implant, where the implant is inserted in your penis, and they also insert a button to blow the implant up. So we can all actually be walking around just, knocking stuff off tables and whatever. But a lot of men don't realize the advantage of that or the possibility that that's even possible. Okay. And then they remove the prostate either by hand or by surgical procedure with a robot.
Okay, whoa, bro. Pause right there now. You talking about by hand?
Well, yeah. Initially, doctors cut out that prostate by hand. They've proceeded to the robot because the robot is a lot more precise. Seriously, as long as they calibrate that robot.
All right. Yeah, that sounds very uncomfortable. So,
well, you're out for that.
Mm.
That you're out for. The biopsy, you're not. That's the uncomfortable part right there. The biopsy, you're not. And let me show you let me give you a true story of what happens when you don't keep up with yourself and follow the symptoms along. I was diagnosed with a prostate level from 1 to 4.9 in a year's time. doctor said right off the bat, we need to do a biopsy. We'll set you up, No more discussion. And what's important for me is, let's talk about this, because there are things that we have in our bodies that can produce false positives. So you have a lot of false positives that are possible. Spicy foods is one. If you have a enlarged prostate just by itself, that's number 2. If you have an inflammation or a infection of the prostate, that's number 3. If you have a bladder infection or an infection of the urethra, number 4. Any kind of inflammatory disease that's chronic can produce a false positive. Okay, so I had a discussion with the doctor, and I said, hey, nobody, we didn't talk about the qualifying questions. And he was arrogant, brother, which doesn't bother me. But, what are you talking about? So I named that out. I gave him an ultimatum. I said, look, let's look back at this at 2 months. I took some herbs. I took some alkaline products that alkalize my body and so forth within that 2 months. My PSA, I went to my other doctor to do the PSA and not the urologist. PSA was 1.1.
So basically you had a false positive?
Exactly.
Really? So what caused that?
Well, I eat spicy foods and I have chronic prostatitis. So if you have a chronic inflammatory or infection like that comes and goes, that can cause false positives. So brothers, I insisted that men really need to stay on top of this thing, because it's going to happen to you sooner or later, according to the American medical. 70% likely, 80% likely. If you're blessed with 90 years, you got it. So to say, but, that doesn't necessarily have to be the issue. I mean, God gave us plants and herbs and grasses and all kinds of things to heal us, because he knew what we were going to be facing as we were just a frame. So all these things that doctors say are incurable, they're only incurable because they either don't want to cure it, because they monetizing the disease, or they don't know how to do it. Okay. So, my suggestion would be, study all the angles, go to Western medicine. Diagnostics are the best in the world, but then, consider your treatment options and what's best for you.
Yeah, you say go to Western medicines. I hear you.
I know what you're getting ready to say, Smitty.
You got to participate in your own rescue here. Stay away from that fried food. Drink plenty of water.
Right.
I know you told us some of the good things to do, but we also have to take some preventative measures as well.
Absolutely.
My first comment is always that there's nothing too big for God. So, you stay prayed up as well, and make sure you don't ever forsake that. But just as important, I shouldn't say more important, but just as important though, dieting. And that's why I asked that question earlier about what should we stay away from. You mentioned spicy foods, and I know I've heard about the, fried foods and things of that nature. But is there anything else that men out there that we can take responsibility for? Well, one of them I know for sure is that we can take our behinds to the doctor on the regular.
Bingo.
You know what I'm saying?
Bingo. Right there.
Women, they go to the doctor on the regular, man. And a lot of us guys, I don't know where you get this Rambo John Wayne mess from, thinking that you're tough and rough and don't go to the doctor and it's just a little bit of something. And that ends up taking you out before it's your time. So, what do you say, PC? I mean,
I agree totally. That is the major thing. Need to go to the doctor. Need to get the diagnostics in play Find out what's going on with your body, because after all, there are a lot of things that happen to our bodies that sneak up on us that have no symptoms whatsoever. So how do you know what's growing inside of you if you don't go to the doctor on a regular basis and get the blood tests and all the other tests that might apply to whatever the situation is?
I use the same philosophy with that too. The best time to go to a doctor is before you get sick. Okay.
Right.
When you're feeling well, go to the doctor then. A lot of times we wait until there's a sign or a symptom or something before we go to the doctor. I use that same philosophy when I'm doing business. The best time to talk to an attorney about a business is before you need them. All right. So before you enter that contract, before you sign that contract for a lease or whatever business that you're transacting. So if you're going to protect your financial health, then you doggone well should be very wise in protecting your lifelong health, because you only get this one temple and it's supposed to last up a lifetime. And that lifetime is predicated upon how well you take care of the temple.
That's right. You're absolutely right. And it applies the same way with your health that it does with the business model. You need to be ahead of the game in terms of what's going on with your body. And the only way to do that, which could be a whole nother show, is preventatively. The more we prevent, it's like a football team. If you have a prevent defense, 9 times out of 10, your opponent's not going to score. You know what I mean? We have to go with what's comfortable to us. Is a man thinking that, okay, I can't have an erection, in his mind, that I'll go through the seed and the bean process. There are issues with that. The side effects of radiation. You thinking you're going to pass a fart, but then you ooze a little crap in your pants. And nausea takes effect. You got diarrhea. The question is, at that point, when you're sitting talking to the doctor or you're sitting with your wife at home, can I deal with this, with these symptoms versus dealing with the other symptoms? So it's necessary to look at all the options and figure out what's best, what's most comfortable, what's most tolerable for you, but you got to do something. And then after you've looked at all the options, you pick out an option that's best for you and your way of thinking. A lot of times, if the cancer is caught early, you still live a long, productive life afterwards. You know what I mean? It just depends. Now, as far as the radiation concerned, a lot of people that do the radiation, that cancer comes back. And it comes back with a vengeance. I've seen it. And so I would like to offer to men that there's certainly other options. There are also, they use hormonal therapy in a lot of cases, because these type of cancers like prostate cancer, the breast cancer, they feed off of hormones like estrogen or testosterone in our case. You mentioned foods to eat or not to eat. Sugar is one of them. Cancer is always going to go to sugar and gobble up the sugar to grow and get bigger and multiply. So you want to sugar. Sugar is a main thing that you want to exclude from your diet right off the bat when they tell you that you have cancer. And if you go to a holistic doctor for cancer treatment, that's what a holistic doctor's going to tell you if he's on his game.
This might be a good time to add this point also. We're encouraging everybody to go to the doctor, but you also have to be your own advocate. I know last time I went for a physical, the doctor asked me if they wanted to do a digital rectal, and I said, of course, because I want to make sure that I stay up on my prostate, situation. But interesting enough, I didn't find out until I got my blood work back was that they didn't do the PSA. that's something that they don't do automatically anymore. So you have to ask for that. So I intend to ask for that the next time I go in to see my doctor. And then secondly, there's a new test. Well, I don't know how new it is, but it was new to me. It's called a cognitive assessment, which Medicare provides to anyone that's a Medicare card holding person. It's free. And basically what they do is they take you in and they do tests like your balance, your hearing, your memory, both short term and long term. So these are kind of things that we need to be aware of during exams. Like I said, being your own advocate when you go in for a physical. It's just not go in and let the doctor do whatever they want to, but you got to have questions. And as the year goes on, you need to make a list of things that, you're concerned. You may have a rash here or hurt here or bump here, and you may think of it at the time it occurs, but you need to make a list of that so that when you go in for that yearly exam, you can bring that up to the doctor so you can get all your questions answered. Boy, this is a great segment, PC. You kind of outdid yourself, I think. You gave us a lot of good information regarding prostate cancer, but not only good information, but you also gave us some things that we can do to avoid it. And then you can give us some things to do if we get it that we can do. So different types of treatment. So I thought you really covered the subject well. And this is something that we can't do too much of. There's so many Black men out here suffering from prostate cancer, catching it at the wrong stages. But like you said, if you catch it early, there's a chance that you're going to live a long and fulfilling life. So, hey, with that said, we're going to end this podcast. I think it was a great podcast. And as always, we always try to leave you with some words of wisdom. And like I said, my words for 2023 are, hey, you can either give up, you can give in, or you can give all you got. And I'm giving all I got in every situation. So as we always say, if you didn't know, now you know. Peace.